Hi friends, hello, good morning to everyone. Welcome to our channel, The Voice of Nurse. Today's class we are going to discuss model paper for Staff Nurse 2023. Today's class we are going to discuss continuous topic from the previous model paper. This is part 2 friends. Already we discussed related to the model papers. First set and second set we already finished. This is third set. In third set we discussing today's class. Second part means we discussed 30 questions in the part 1 related to the third model paper for Staff Nurses 2023. In third set of model paper part 1 we discuss related to the previous year's model paper FAQs and model paper related to the staff nurse. 30 question we discussed in part 1. Not only third model paper we discuss related to the model papers 2 sets previous classes. I will give a link in description related to the 2 sets of model paper previous classes. I will give a link in description. Please check it friends. Anybody here new to channel, anybody new subscribers here, please check it once all model papers, and along with model papers please check it all subjects related to the FAQs and very important questions regarding all subjects. Each subject we discussed 100 questions, one set of 100 questions. Each and every subject we discussed related to the FAQs, very important questions. We finished almost 95% of subjects. Previous classes onwards we are discussing model papers only. Not only this model paper subjects already we know. Already I prepared previous video also. TS MHSRB staff nurse 2nd August 2023 they are conducting 2nd August 2023 exam. We all know about that. But new news, this is mark test related to the CBT, computer based test. How we have to attend the exam, what is the process, what is the guidelines, rules and regulation, what is marks for review option. I already explained in previous video. Please check it once friends. Mock test related to the process, mock test link previous video I will give a link in description. Please check it once friends. Before moving on to topic, anybody here newly subscribed or anybody here new to channel, please subscribe my channel, click on the bell icon for further notification, and please give a like and share your opinion in comment section. If any doubts also you can ask in comment section. Let's move on to today's class, third model paper for staff nurse 2023 part 2. Today we are going to discuss part 2 from question number 31 to question number 60. In this today's class we are going to discuss 30 questions in part 2 model paper. Question number 31. Cytokines are chemical messengers. Which of the following? Here cytokines are chemical messengers from the following. We will see here options. Option A, promote inflammation. Option B, kill microorganisms. Option C, produce antibodies. Option D, severe pain. Here what is meant by cytokines chemical messengers? Cytokines of chemical messengers, what is mean by, we will see discussion. Cytokines affect the growth of all blood cells and other cells that help the body's immune and inflammation responses. They also help to boost anti-cancer activity by sending signals that can help make abnormal cells die and normal cells live longer. One specific type of cytokinase is called as chemokine. Cytokinase means one of the specific type of cytokines is called as chemokine. Cytokines have important roles in chemically induced tissue damage repair, in cancer development and progression, the control of cell replication and apoptosis, and in the modulation of immune reactions such as sensitization. Cytokines are the primary chemical messengers involved in both acute and chronic inflammation. attracting and activating phagocytes, promoting the clotting of blood and facilitating the production of additional chemical messengers including more cytokines. So here in these options, option A is the correct answer. Cytokines or chemical messengers, which of the following means? Here option A, promote inflammation, is the correct answer. Next we will move on to question number 32. Function of hospital is. What is the functions of hospital from the following? We will see here options. Option A, promotion of health. Option B, medical education. Option C, care of sick person. Option D, all of the above. Modern hospital is a facility that specializes in the diagnosis and treatment of illness and injury. Hospitals provide a wide range of medical services including emergency care, surgery and childbirth. They also offer a variety of other services such as outpatient care, OPD, diagnostic tests and rehabilitation. Hospital, an institution that is built, staffed and equipped for the diagnosis of disease, for the treatment, both medical and surgical, of the sick and injured, and for their housing during this process. The modern hospital also often serves as a center for investigation and for teaching. The main functions of hospitals: medical services, administrative services, patient care and education, diagnosis, treatment of illnesses, rehabilitation and patient care, diagnosis and treatment diseases, outpatient services, medical and medical education and training, prevention of diseases and promotion of health. These all are related to the functions of hospital. So here option D, all of the above, is the correct answer. Functions of hospital is promotion of health, medical education, care of sick person. All of the above is the correct answer. Next we will move on to question number 33. The sudden redness of the skin is known as. Suddenly developed a redness on the skin, it is termed as. We will see here options. Option A, cyanosis. Option B, jaundice. Option C, pallor. Option D, flush. Skin that is suddenly red and burning, sometimes called as erythema or flushing. It is a common symptom with many potential causes. Sunburn, exposure to an irritant and medication use are just a few. Most cases of skin redness are easy to diagnose and treat. What is the causes sudden redness means? Skin redness have many different causes, includes burns, allergic reactions, infections and some health conditions such as dermatitis and darker complexions. These conditions may cause the skin to become darker. So here the sudden redness of the skin is known as flush or flushing. Here in this option, option D is the correct answer. Next we will move on to question number 34. Flaxine present in the. What is flaxine? Flaxine is present in which condition? We will see here options. Option A, marasmus. Option B, kwashiorkor. Option C, scurvy. Option D, none of the above. What is flaxine? We will see now. A peculiar change in hair color in which are the hair become discolored in a band perpendicular to its long axis. This phenomenon has been termed the flaxine and is known to exist in kwashiorkor condition. Kwashiorkor is characterized by peripheral pitting edema as well as moon facies, hematomegaly and pursed mouth. Flaxine in malnutrition. Depigmentation of hair causes it to the reddish yellow to white. Curly hair becomes straightened. If periods of poor nutrition are impressed with good nutrition, alternating bands of pale and dark hair is present. This respectively called as flaxine to the poor nutrition. So, due to the poor or malnutrition, alternating bands of pale and dark hair is respectively called as flaxine. In the condition of kwashiorkor, we can see the flaxine. So here in these options, flaxine is present in option B, kwashiorkor is the correct answer. Next we will move on to question number 35. What is odynophagia? What is meant by odynophagia? We will see here options. Option A, regurgitation. Option B, pain during swallowing. Option C, difficulty swallowing. Option D, unable to swallowing. Odynophagia is the medical term for painful swallowing. Pain can be felt in your mouth, the throat, or esophagus. You may experience painful swallowing when drinking or eating food. Sometimes swallowing difficulty is known as dysphagia. Odynophagia is different, dysphagia is different. Dysphagia means difficulty to swallowing. Odynophagia means painful swallowing. But odynophagia is often a condition it is own. How we can diagnose odynophagia means X-ray with a contrast material. You drink a barium solution that coats your esophagus, making it easier to see on X-rays. Your healthcare provider can then see changes shape of your esophagus and can assess the muscular activity. Most common causes of odynophagia is causative ingestion, pill-induced esophagitis, radiation injury and infectious esophagitis, example candida, herpes viruses and cytomegaloviruses. So here odynophagia means pain during the swallowing. Difficulty swallowing means dysphagia. So here odynophagia, here option B is the correct answer, option B. Next we will move on to question number 36. The third stage of labor includes. What is the third stage of labor? From the following, we will see here options. Option A, expulsion of placenta. Option B, complete expulsion of fetus. Option C, rupture of membranes. Option D, full dilatation of cervix. The labor is divided into 4 stages. Stage 1, Stage 2, Stage 3 and Stage 4. In Stage 1, first stage of labor is Stage 1 includes full dilatation of the cervix to baby moved into the birth canal. Second stage of labor means complete expulsion of fetus. Third stage means expulsion of placenta to rupture of membranes. Fourth stage means observational stage. This is labor stages. Here, third stage of labor means expulsion of placenta. So, third stage of labor is time between delivery of the baby and expulsion of the placenta. So here in this options A is the correct answer. Next we will move on to question number 37. Which is the method of administration of NTG? Here the drug name is NTG. Administration means drug only, friends. Here, which method we can administer NTG? NTG means nitroglycerin. We will see here options. Option A, intramuscular. Option B, subcutaneous. Option C, sublingual. Option D, intraosseous. Nitroglycerin we can administer intravenously, means IV routes of administration for nitroglycerin used most commonly in emergency situation and also in the intensive care units and ICUs, cardiac ICUs. What is NTG? NTG is a drug is used to prevent angina pectoris, means chest pain caused by coronary artery disease. This medicine is also used to relieve angina attack that is already occurring. So here NTG we can give through the IV route. If it is emergency and cardiac units, we can provide injection through the IV route. But here there is no IV. Here method of administration of NTG means the NTG nitroglycerin, place the tablet under the tongue or between the cheek and gum and let it dissolve. Do not eat, drink, smoke or use chewing tobacco while the tablet is dissolving. Nitroglycerin is sublingual tablets usually give a relief in 1 to 5 minutes after administration of NTG. So here which method of administration of NTG means sublingual. Option C is the correct answer here. Next we will move on to question number 38. Lethal dose means, what is mean by lethal dose? We will see here options. Option A, larger than maximum. Option B, larger than minimum. Option C, larger than the amount Option D, all of the above. Lethal dose is an amount of drug or other agent that will kill a human or animal if administered. Lethal dose is an indication of the lethal toxicity of a given substance or type of radiation because resistance varies from one individual to another. The lethal dose represents a dose at which given percentage of subjects will die. So here the lethal dose is larger than the maximum. Here lethal means the dose should be larger than the maximum. So here option A is the correct answer. Next we will move on to question number 39. Ringing in the ear is called as. Ringing in the ear is termed as. We will see here options. Option A, vertigo. Option B, dizziness. Option C, tinnitus. Option D, vibration. Term ringing in the ears is termed as tinnitus. Tinnitus is the medical term for hearing noises in the ears. It occurs when there is no outside source of the sound. Tinnitus is often called as ringing in the ears. It may also sound like blowing, roaring, buzzing, hissing, humming, whistling, or sizzling. Tinnitus is the perception of sound that does not have an external source, so other people cannot hear it. Tinnitus is commonly described as ringing sound in the ear. So in name only is there in the ear. Ringing sound in the ear means it is present in the inside only. So this is not outside source. So here the ringing in the ear is called as tinnitus. So here in these options, option C is the correct answer, tinnitus. Next we will move on to question number 40. According to Maclver, family is primarily based on which of the following? According to the Maclver, we will see here options. Option A, economic provision. Option B, inhabitation. Option C, mating relationship. Option D, none of the above. According to Maclver, family is a group defined by sex relationship sufficiently precise and enduring to provide for the procreation and upbringing of children of all human groups. Family is the most important universal primary group. The family is not merely an association. Family is the biological social unit composed of husband, wife, and children. Maclver defined as family as a group by sex relationship sufficiently precise enduring the providing procreation of upbringing the children. So here the option C, mating relationship. According to the Maclver, family is primarily based on mating relationship. So here in this option, option C is the correct answer. Next we will move on to question number 41. Marfan syndrome most commonly involves. See here options. Option A, arch of aorta. Option B, ascending aorta. Option C, descending aorta. Option D, all of the above. What is Marfan syndrome? We have to know. Marfan syndrome is inherited as an autosomal dominant condition. Dominant genetic disorders occurs when only a single copy of abnormal gene. Marfan syndrome is a systemic disorder of connective tissue caused by mutations in the extracellular matrix protein fibrillin. So here Marfan syndrome most commonly affects the heart, eyes, blood vessels and skeleton. Most common Marfan syndrome is most common affects in men and women equally and occurs among all races and ethnic groups because its genetic condition. The greatest risk factor for Marfan syndrome is having parent with the disorder. The aneurysm in the aortic root, part of the ascending aorta, the section closest to the heart. The aneurysm is aortic root is specific to Marfan syndrome. Aneurysm in the other parts of the aorta is more common in other disorders such as bicuspid aortic valve and Turner syndromes. So here in these options, option B is the correct answer. Marfan syndrome most commonly involves in heart ascending aorta. Option B is the correct answer here. Next we will move on to question number 42. Pico means Pico. What is meant by Pico? We'll see here options. Option A, population intervention comparison outcome. Option B, population incredibility comparison outcome. Option C, population intervention communication outcome. Option D, none of the above. One way to construct a well-built question is use the Pico model. Pico stands for patient or population, intervention, comparison and outcomes. Code forming element used in making names for every small units of measure. In 1915, from Spanish pico, a little over a small balance, literally short point break, a word of Celtic origin. Pico is from the word from the Celtic origin, from the Spanish. So here Pico, Pico means stands for patient or population, intervention, comparison and outcome. So here in these options, option A is the correct answer, population, intervention, comparison and outcome. Next we will move on to question number 43. The circulatory nerves who assist. The circulatory nerves have to assist. We will see here options. Option A, surgeon. Option B, scrub nurse. Option C, A&M. Option D, A and B. Circulatory nurses provide additional supplies and sterile instruments as needed during the operation and assist the other team members in monitoring the status of patient or helping with the repositioning of the patient during the procedure. The circulatory nurse, registered nurse who makes preparation for an operation and continually monitors the patient and staff during its course, who works in the operating room outside the sterile field in which the operation takes place, and who records the progress of the operation, accounts for the instruments and handles specimens. Operating room, the duties of circulatory nurse are carried out outside the sterile area. The registered nurse circulator manages all necessary care inside the surgery room, assisting team maintaining the creating comfortable, safe environment for patient and observing the team from a wide perspective. Circulating nurse are more responsible for the environment being clean and assisting the patient pre-surgery and post-surgery. Circulatory nursing may assist the scrub nurses, but scrub nurses have to monitor patient's condition during the surgery. So here in these options, option B is the correct answer. Circulatory nurse who assist means scrub nurse. So here in this option, option B is the correct answer. We will move on to question number 44. The term vaccine was coined by. Vaccine word is coined by whom? We will see here options. Option A, Edward Jenner. Option B, Louis Pasteur. Option C, Kito Sato. Option D, Paul. Term first used vaccine was created by Edward Jenner. Edward Jenner coined the term vaccine and vaccination. It is derived from the cow smallpox. From Latin word, English physician Edward Jenner coined the term vaccination in the year of 1796 to describe inserting pus from cowpox lesions into open cuts on human patients to prevent smallpox. Father of vaccination in India is Talwar, Garsaran Talwar. He is father of vaccination in India. So here in these options, option A is the correct answer. The term vaccine was coined by Edward Jenner. Option A is the correct answer. Next we will move on to question number 45. Here, children with symptomatic HIV infection should be given all vaccine except. Here the children is having symptomatic of HIV infection. So we had to give all vaccines except from the following. We will see here options. Option A, DPT. Option B, BCG. Option C, OPV. Option D, none of the above. The following vaccines are recommended for all people with HIV: hepatitis B, HPV, influenza, meningococcal, pneumococcal and tetanus, diphtheria and pertussis means DPT and TT. Here contraindications for the symptomatic HIV patient means we have to hold BCG vaccine is contraindicated in people with impaired immunity, and WHO does not recommend BCG vaccination for children with symptomatic of HIV infections. As early in life as possible, HIV exposed infants and children should receive all vaccines under the Expand Program for Immunization EPI. Expand Program for Immunization EPI except BCG vaccine. WHO does not recommend BCG in children with symptomatic HIV infection. So here children with symptomatic HIV infection should be give all vaccine except BCG because they are impaired immunity. So here option B is the correct answer. Next we will move on to question number 46. What is the essential nursing action when caring for a young child with severe diarrhea? Here the child is having severe diarrhea. The essential nursing action. We will see here options. Option A, advise preventive measures. Option B, check daily weight. Option C, administer medication. Option D, none of the above. The three essential elements in the management of children with diarrhea are rehydration therapy, zinc supplementation and counseling for continued feeding and prevention. In diarrhea, there is excessive loss of water electrolytes means here sodium, potassium and bicarbonate and zinc in liquid stools. Make sure that take fiber containing diet such as cereal, grain and metamucil. Provide perianal care after each loose motions. Daily weight monitoring and also the complete blood count test, measurement of electrolytes and kidney function test also is necessary. So here what is the essential nursing action when caring a young child with severe diarrhea means here in these options option B, check daily weight is the correct answer. Option B, here option B is the correct answer. Next we will move on to question number 47. Pathological repetition by imitation of speech of another. What is the pathological repetition by imitation of speech by another is termed? We will see here options. Option A, echopraxia. Option B, euphoria. Option C, A and B. Option D, echolalia. Here I will give a explanation related to the exact answer because related to this medical term we already discussed in psychiatric nursing. The pathological repetition by imitation of speech of another is termed as echopraxia, an involuntary imitation or repetition of someone else's actions, while echolalia is involuntary repetition of language and sounds. Echopraxia is the same but with action. The word itself comes from ancient Greek. Example for the echopraxia: you may observe someone yawning and then have the same thing yawning. So when imitating others' action occurs frequently and involuntary later adolescence as adult, it could be known as echopraxia. So here the pathological repetition by imitation of speech is termed as echopraxia. Here in these options, option A is the correct answer. Next we will move on to question number 48. The fetal birth weight more than 4.5 kg is called as. The fetal birth weight is more than 4.5 kg. It is called as. We will see here options. Option A, polycythemia. Option B, macrosomia. Option C, polyarthria. Option D, monocythemia. Here the word hemifacial macrosomia is the second most common facial birth defect behind cleft lip and cleft palate, affecting one of the every 3,500 to 4,000 births. The term macrosomia is similar term that describes excessive birth weight but refers to an absolute measurement regardless gestational age. Macrosomia is an obstetric condition associated with other potential life-threatening complications to both the mother and fetus. The term macrosomia is derived from Greek word meaning is big and refers to the body, means big body, means which refers to the body. The causes of macrosomia is genetic factors and maternal conditions such as obesity and diabetes can cause fetal macrosomia. Rarely baby might have medical condition that makes him or her grow faster and larger. Sometimes it's unknown what causes a baby too larger than average. The fetal macrosomia occurs in 0.5 to 15% of all pregnancies, 1 or 2. So here the fetal birth weight is more than 4.5 kg is called as macrosomia. Here option B is the correct answer. Next we will move on to question number 49. Under National TB Control Program, DOT means, what is meant by DOT? Under the National Tuberculosis Program, what is meant by DOT? We will see here options. Option A, direct operation therapy. Option B, double observation therapy. Option C, direct observation therapy. Option D, all of the above. DOTS avoids the transition of tuberculosis to others. DOTS reduces the probability of a treatment error. DOTS allows patients to complete their treatment of tuberculosis as quickly and without interruption. The probability of drug resistant tuberculosis resulting from ineffective therapy is decreased. DOTS means directly observed treatment. Short course is a program for patients who suffered with tuberculosis. Here RNTCP is based on the internationally recommended strategy to control a tuberculosis known as directly observed treatment. Short course is known as DOT. So here the under National TB Control Program, DOT means direct observation therapy. So here in these options, option C, direct observation therapy is the correct answer. DOTS means direct observation therapy short term. So here option C is the correct answer. Next we will move on to question number 50. Unconscious patients needs which type of nutrition? Here unconscious patient needs which type of nutrition they need. We will see here option. Option A, high minerals. Option B, high in proteins. Option C, high calories. Option D, all of the above. Through the assessment of critically ill patients will help in deciding the strategic nutritional support and further improvement of the patient outcomes. The total parenteral nutrition is a medication used to manage the treatment of malnourishment. Healthcare professionals should consider using oral, enteral or parenteral nutrition support alone or in combination for people who are either malnourished or yet to risk of malnutrition. As defined above, potential swallowing problems should be taken into account. So here we are having two approaches to give a nutrition in the ICU patient: trophic or full feeding. Trophic feeding has been found to be safe with fewer gastrointestinal complications and recommended up to 6 days from the admission to ICU. Current clinical practices guidelines recommended giving patients with mild or moderate illness 0.8 to 1.2 grams per kg protein per day. Here the protein requirement for most critically ill patient is range of 1.2 to 2.0 grams per kg. Here the extra protein, if you have certain health problem, means need extra protein also. So here the people looking lose weight and physically malnourished means people need to get a high protein diet and high vitamin diet. So here in this option, option B is the correct answer. Next we will move on to question number 51. Prevention of bedsore. What is the preventive measures for the bedsore? Here we will see the options first. Option A, frequently changing of positions. Option B, back care. Option C, making bed without lumps. Option D, all of the above. Shift weight frequently, about once per hour or second hourly once. Ask help if needed. to reposition, perform wheelchair push-ups in which they use their arms to lift off the seat. Select cushion or mattress that relieve pressure. The main preventive measure for the bedsore: shift your weight frequently, ask for help in repositioning about once in an hour, lift yourself if it is possible, look into specialty wheelchairs, select cushions or mattress to relieve pressures, adjust the elevation of the bed. Bedsore can be prevented by inspecting the skin of areas of redness every day with particular attention to bony areas. Regarding nutrition also, we can prevent the bed sores, like a nutritious high protein diet can prevent bed sores or help them heal. Not only protein rich diet, that client need to receive vitamins and mineral supplementation also. The frequently changing of position, second hourly, giving back care and making bed without lumps, nutrition supplementation, these all things related to the prevention of bed sores. So here all of the above, option D is the correct answer. Frequently changing position, back care, making bed without lumps. So here all of the above is the correct answer. Next we will move on to question number 52. What is the best method to measure the hydration of the patient who is severely sick? How we can identify the hydration of the patient? What is the method we can use through the identification of the hydration of the patient who is severely sick? We will see first options. Option A, central venous pressure. Option B, arterial pressure monitoring. Option C, oxygen monitoring. Option D, balloon pumping method. Best methods for measuring hydration status: plasma osmolarity, urine osmolarity, and urine specific gravity are most widely used markers for hydration management, and urine color has also been used with responsible accuracy when laboratory analysis is not available or when a quick estimate of hydration is necessary. What are the technique can be used for the assessing hydration of the patient means the hydration of the assessment, hydration of the patient. Two techniques we are having. The first one was total body water measured by isotope dilution or estimated by bioelectrical independence analysis. The second one is plasma markers such as osmolarity, sodium, hematocrit and hemoglobin changes, concentration of the hormones. These all things comes under the techniques, and also urine markers also one of the technique. Method measuring central venous pressure measured by central venous catheter placed through either the subclavian or internal jugular veins. The central venous pressure can be monitored using a pressure transducer or amplifier. Central venous pressure, which is measures to pressure in the vena cava, can be used an estimation preload right atrial pressure. The central venous pressure is often used as assessment hemodynamic status, particularly in the intensive care unit. So here what is the best method for measuring hydration of the patient who is severely sick means central venous pressure. Here option A is the correct answer. Next we will move on to question number 53. When an injury occurs at cervical cord can leads to, when injury is occurred to the cervical cord, that can leads to which condition? We will see here options. Option A, hemiplegia. Option B, quadriplegia. Option C, paraplegia. Option D, none of the above. See one by one. Option A, hemiplegia. Hemiplegia is loss of strength in the arm, leg and sometimes face on one side of the body. Hemiplegia refers to severe or complete loss of strength. Option B, quadriplegia. Quadriplegia means paralysis below the neck including both arms and legs is called as quadriplegia. Next option C, paraplegia. Paraplegia is a paralysis that affects all or part of the torso, legs and pelvic organs. Paraplegia can occur after the spinal cord injury caused by damage of the vertebrae, ligaments or disc of the spinal column. If there is any injury in the cervical area, it results to the Tetraplegia. So here there is no tetraplegia, means also called as quadriplegia. Tetraplegia is also known as quadriplegia, meaning there is limited or absent feeling or movement below the shoulders and neck. So here the cervical area is injured, means result for the condition. It can lead to tetraplegia or quadriplegia. Here option B is the correct answer. An injury higher on the spinal cord can cause paralysis in the most of your body, affects all limbs, tetraplegia or quadriplegia. A lower injury to the spinal cord may cause paralysis affecting the legs, lower body. It is called as paraplegia. So here the cervical cord injured means it can lead to quadriplegia or tetraplegia. So here in this option B is the correct answer. Next we will move on to question number 54. Deficiency of niacin. What is the deficiency of niacin causes? We will see here options. Option A, weakness. Option B, pellagra. Option C, pruritus. Option D, scurvy. Niacin is also called as vitamin B3. Deficiency results in a condition known as pellagra. Pellagra includes a triad of dermatitis, dementia and diarrhea and can result in death. In addition, niacin deficiency can occur through genetic disorders, malabsorptive conditions and interaction with certain medications. What is caused by niacin deficiency means the severe niacin deficiency leads to pellagra, a condition that causes a dark, sometimes scaly rash to develop on skin areas exposed to sunlight, bright redness of the tongue and constipation or diarrhea. So here the pellagra is a disease caused by a deficiency of niacin, otherwise it is known as vitamin B3. It is a form of malnutrition. Here in these options, deficiency of niacin causes pellagra. Option B is the correct answer here. Next we will move on to question number 55. Zero polio is given at. Zero polio is given at. We will see here options. Option A, 6 weeks. Option B, 9 weeks. Option C, at birth. Option D, 6 months. OPV is a zero dose. Oral polio vaccine is a zero dose. This is the first dose taken at birth. The next dose taken when the child is 6 weeks. The third dose at 10 weeks and last dose was 14 weeks old. So here the zero polio vaccine means at birth. Using data from national surveys carried out in 92 LMICs since 2010 and focusing on 4 basic vaccines delivered in infancy. Those are BCG, polio, DPT and MCV. We describe zero dose prevalence and the immunization card children aged at 12 to 23 months itself. Here zero polio is also called as oral polio vaccine, nothing but oral polio vaccine, OPV. Here administration of OPV dose at birth is zero dose, serves in priming dose since it is not protective to the vaccines. So here the zero polio vaccine is given at birth. Option C is the correct answer here. Next we will move on to question number 56. Insulin is secreted by. Insulin is secreted by. We will see options. Option A, alpha cells. Option B, beta cells. Option C, gamma cells. Option D, delta cells. Pancreatic beta cell dysfunction plays an important role in the pathogenesis of both type 1 and type 2 diabetes. Insulin, which is produced in beta cells, is a critical regulator of metabolism. Insulin is synthesized as pre-proinsulin and processed to proinsulin. Insulin is secreted from islets of Langerhans are made up of different type of cells that make hormones. The commonest one are beta cells which produce insulin. Insulin is the when released from the pancreas into bloodstream so that can reach different parts of the body. How insulin will help in our body? Insulin is a hormone that helps control our body's blood sugar levels and metabolism. The process that turns the food you eat into energy. Here the insulin was secreted by beta cells and pancreas itself. So here in these options, option B is the correct answer. Next we will move on to question number T7. Which one from the following condition caused by deficiency of vitamin A? From the following, which condition can cause by deficiency of vitamin A? We will see here options. Option A, beriberi. Option B, scurvy. Option C, bitot spots. Option D, all of the above. Vitamin A deficiency results from a dietary intake of vitamin A that is inadequate to satisfy physiological needs. It may be exacerbated by high rates of infection, especially diarrhea and measles. It's common in developing countries but rarely seen in developed countries. Due to the vitamin A deficiency, we can see some of these symptoms like night blindness, xerophthalmia, infection, bitot spots, skin irritation, xeratomalacia, and also stunted growth. So lack of vitamin A affects the development of goblet cells in the conjunctiva, resulting in accumulation of keratin debris. The bitot spots also demonstrate keratinization, irregular maturation, inflammatory infiltration, and accumulations of gram-positive bacilli. So bitot spots are specific manifestation of vitamin A deficiency. There are triangular, dry, whitish, foamy appearance lesions which are located more commonly in temporal side. The mainly composed of keratin admixture with gas forming bacteria leads to foamy appearance and also xerosis. So here, which one from the following condition can cause vitamin A deficiency means option C, bitot spots is the correct answer here. Next we will move on to question number 58. Eye padding is applied unconscious patients to prevent. Eye padding is applied to the unconscious patients to prevent what? We will discuss options first. Option A, dryness of eyes. Option B, corneal ulcer. Option C, eye movement. Option D, decreased infection. To protect eyes with an eye shield. If eyes remain open for long period, corneal ulceration will develop. So make sure the client eyes should not be rubbing or should not be open always. Eye padding is applied unconscious patient or severely sick is ventilatory patient. We can provide eye padding to prevent a corneal ulcer. The topical anesthetic drops should be avoided, as should local steroids unless there is a marked edema, to prevent corneal ulcer through the eye padding of the patient. So here option B is the correct answer. Eye padding is applied unconscious patient to prevent a corneal ulcers. So here option B is the correct answer. Next we will move on to question number 59. Who is key person in ICDS program? Who is the key person in ICDS program? We will see here options. Option A, village health guide. Option B, Anganwadi worker. Option C, community health workers or community health volunteers. Option D, social worker. Integrated Child Development Scheme ICDS, providing for supplementary nutrition, immunization and preschool education to the children, is a popular flagship program of the government. The principal worker in the ICDS project is Anganwadi workers. ICDS program mainly works at the preschool children level, hence Anganwadi workers are the principal workers in the ICDS programs. Functions of Anganwadi workers: supplementary nutrition for the children under 5 years, pregnant women and nursing mothers. Is known as Anganwadi workers means a woman employed to provide additional and supplementary health care and nutritional health service to children and pregnant women under the Integrated Child Development Services ICDS scheme. So here, who is key person in ICDS program means option B, Anganwadi worker is the correct answer here, option B. Next we will move on to question number 60. 60th question is last question in this part 2 video, third set of model paper. Next upcoming videos we will discuss from the 61 question onwards. Now we will see last question in this video, 60 question. Which of the following instrument is used to record intraocular pressure IOP? From the following option, which instrument we can use to monitor or record the intraocular pressure? We will see here options. Option A, tonometer. Option B, goniometer. Option C, ophthalmoscopy. Option D, slit lamp. An eye care specialist will measure eye pressure with a test called as tonometry. Tonometry measures the pressure inside of the eye by flattening the cornea. The more force that's needed flatten your cornea, the higher of eye pressure is. How do you monitor eye pressure? Place the tip of the both index fingers on the closed upper eyelid, keeping both fingers in the contact with the upper eyelid. Apply gentle pressure through the closed eyelid, first gently pressuring on the eye with the right index finger, then the left hand with the right again. Here from the following options means following the instruments. Option A, tonometer is used to monitor or record the intraocular pressure. So here in these options, option A is the correct answer, tonometer. This is last question in this part 2 related to the third set of model paper. Next upcoming classes we will discuss further question. And one more thing I have to mention regarding mock test. We are having online mock test in the Medical Health Services Recruitment Board link. Just check it once, friends. Online mock test is going on. Related to the mock test with explanation process, mock test link related to the negative marking, what is the marks and review questioning already discussed related to the previous video. Just check it once, friends. This is part 2 related to the third model paper of Staff Nurse 2023. So thank you, friends. Thank you for watching. If you are new to channel, please subscribe my channel, click on the bell icon for further notification, and please share your opinion in comment section and give a like and share the video to your friends. Thank you. Stay tuned. Keep watching, friends.